I'd like to introduce you to Telford and Wrekin Health and Social Care Rapid Response Team. We're going to tell you how we help support people of Telford and Wrekin and prevent avoidable hospital admissions.
The Health and Social Care Rapid Response Team launched in November 2019 and it supports Telford and Wrekin residents who are experiencing a rapid decline of their health and are in a crisis and risk of going into hospital or being admitted into hospital. The service was set up to enable closer working partnerships, and it integrates social workers, physiotherapists, occupational therapists, paramedics, non-medical prescribers and community nurses into one team. There's a 2-hour response from being referred to the service.
It's a multi-professional team that receive referrals from a number of different professionals. The referrals have to come in from various professionals as opposed to members of the public. Once the referral is received, it's triaged and then passed on to the most appropriate professional within the team, either a social worker or a nurse, or perhaps even triaged to the physio or occupational therapists. And then in addition to that, we can do joint visits as well if it's felt that it's more appropriate for both a nurse and a social worker to attend to the service user or the patient.
So going on from the joint team working and how it all integrates and comes together, very good feedback that we had recently from a couple whose husband was recently discharged from hospital very poorly. Came home, wife thought she could manage and cope with everything the way they had done before. We originally had the referral from the GP, went out, did our assessment. Again, wife stated that she was fine, she was managing, she could do everything. But as nurses, you could kind of tell that things might decline. So gave her the number, said that we would follow them up the next day, gave her our number so she could contact us, which, to be fair, within 24 hours she realised that things weren't as well as before. Phoned us up, we went straight back out, we got Chris, the social worker, involved, so we put everything together, got care in place to support her and her husband, and it just worked out really well. They were extremely happy and gave us some really lovely feedback on the whole journey, really, of him coming out of hospital and just the support they had at home.
I'd like to thank the team for their care and compassion towards their patients, and also to system-wide partners for their support in integrating the health and social care team and making the team a success to date.